Hey everybody, welcome back to my channel. Got another video for you guys, but before we dive into it, please hit that subscribe button, hit the like button, comment, share the video. All right, let's dig into it. Got an article here from Health IT Security, which this website here focuses heavily on healthcare related security incidents, privacy issues, what have you. 120,000 priority health members impacted by third-party data breach. Michigan-based health plan Priority Health notified approximately 120,000 individuals of a third-party data breach that originated at the law firm Warner Norcross and Judd. Now, comes back to third parties and vendor management. Make sure you have a good program in place that addresses these issues because a lot of times your data will be sitting on these third party vendor systems, etc., and they end up getting hacked into and your information is stolen. And now you have to explain to your customers, or clients, employees, etc., that the information was compromised in these attacks. Make sure you have proper legal documentation. Make sure you're properly reviewing their security policies, their security posture. Make sure that third party vendor is doing the right things at their organization so that it is less likely to negatively impact your own organization. Let's scroll down here. Priority Health issued a notice, but third-party data breach originated at that law firm back in October 2021. Wow, that's quite a long time ago. Let's see, they took steps to secure its network and notified Priority Health of the incident on June 6, 2022. The incident impacted approximately 120,000 Priority Health members. Although there has been no evidence of misuse, the unauthorized party potentially accessed first names, last names, pharmacy and claim information, drug names, and prescription dates from certain prescriptions filled in 2012. Wow, holy crap, that's a lot of information that's possibly been stolen and can be misused. Obviously, there's not going to be any evidence of it because it just happened, back in October 2021. But it should actually be it should actually be said that there's no evidence of misuse of information yet because it's probably going to happen. I mean, first names, last name stolen, pharmacy and claim information, and whatever claim information consists of. I mean, could possibly be used in fraudulent activity, or it can be used in extortion attempts, or even in phishing emails. They can craft specifically phishing emails towards those individuals impacted, and then try to scam them that way. See, of course, they sent the potentially impacted individuals, provided resources to assist them, whatever that consists of, probably some kind of credit monitoring, identity monitoring service. That seems to be the norm when it comes to these data breaches. Next one down here, behavioral health group breach impacts 197,000. Texas-based BHG, also known as BHG Holdings, suffered a data breach or data security incident that impacted 197,507 individuals. According to a notice on its website, discovered that unauthorized parties had potentially removed certain files and folders from portions of its network December 5th, 2021. Wow. BHG said it immediately took steps to secure its network, so that investigation took a while. As you can see from the investigation, that they noticed that they had discovered some kind of security incident, and then to today, that they released this disclosure of it. By June 2022, BHG determined that the files and folders contained information on individuals who had received services from BHG, including names, social security numbers, driver's license numbers, financial account information, biometrics. You can read the rest there, but as you can see, there's a lot of sensitive and personal information that will probably be used in identity theft or any type of other fraudulent activity. So I recommend you guys have some kind of credit monitoring, identity theft monitoring service, or better yet, securing those services down, like IRS has some kind of PIN. Last time I checked, they had some kind of PIN that you can set up for your tax refund accounts and stuff like that, so that you have to have that PIN in order to submit tax refunds in your name. But be sure to look into those identity protection services, and you have those alerts and such set up, so you'll be notified if someone tries to misuse your information, or if your information has been stolen and is on for sale on the dark web somewhere. All right, let's get back to it. In response to the incident, BSG has strengthened its network, implemented additional security improvements recommended by third-party cybersecurity experts, notice stated. These include resetting account passwords and strengthening its password security policies, implementing multi-factor authentication for network access, upgrading its endpoint detection software integration at 24/7, third-party security monitoring service and coordination or coordinating additional employee training. See, this stuff here is just like the fundamentals, the basic stuff you should already be doing. Like MFA, come on now, passwords are a thing of the past. You know, people are going to use weak passwords, so you should probably be using a strong password minimum requirement. You know, probably 15-character minimum. Make sure the password is complex. Make sure people are actually using passphrases instead of simple, easy to guess passwords, because the attackers are going to use automated tools to crack these passwords. Let's see here, endpoint detection software that should be upgraded regularly to make sure that the virus definitions are up to date, or the features and bugs and stuff are worked out in the endpoint detection software, and make sure that stuff is tuned out so you're not getting a bunch of noise in your SIM or other monitoring tools. I mean, like I said, basic stuff. A lot of stuff comes down to basic stuff. The organization was failing in that area. They didn't think it was a big deal until they got punched in the mouth, and now they have a data breach in their hands to deal with. See, the last one here, first choice community healthcare in Albuquerque, New York began notifying 101,541 individuals of a data security incident that involved the information of patients who sought treatment at first choice. So such activity on March 27, 2022. So it's relatively recent. Information involved includes names, social security numbers, patient ID numbers, medications, dates of service, and the rest you can read there. More sensitive information, personal identifiable information, medical information, what have you. They got pretty much owned. That's a lot of people affected by that. I feel sorry for those guys that have been affected by this breach. So the organization began notifying impacted individuals of the incident on August 1. Okay, that's pretty big time frame. So this investigation probably took a while to get it all sorted out. The privacy and protection of personal and protected health information is a top priority for first choice. We deeply regret, which deeply regrets any inconvenience or concern this incident may cause, the notice stated. So are they going to provide some kind of monitoring service for the impacted individuals? What's going on here? All of these breaches here, I mean, I can see some kind of class action lawsuits coming to these organizations, especially if they find out that the information stolen or has been used in malicious activity, fraudulent activity on the dark web somewhere. But anyway, check out this article, read through it, and try to determine, lessons learned, what could have been done better at these organizations. Maybe your organization is lacking in some of these areas. See if there's any of this information here would apply to your organization, and then try to develop possible solutions in your organization so you can plug some of these vulnerabilities or put mitigations in place, compensating controls in place, or even just improve your overall security posture of your organization. I like to use these as lessons learned, like as I stated, so that my organization doesn't become a news headline or in the news somewhere. So that just gives a black eye to the credibility of the organization or the organization's reputation. Anyway, thanks for watching this video. Be sure to hit that subscribe button, hit the like button, comment below, share the video, and thank you.